This is a short presentation and a generalized presentation on how to complete a SOAP note for a patient. When we are doing our SOAP notes, you will find your template on your desktop, and it's going to look like this. The parentheses behind the headings are the things that we are looking for. They're examples of what we're looking for to help guide you through your notes. So how I'm going to do this, and I'm just going to kind of go through each area really quick and kind of explain what we're doing. I'm going to create my SOAP notes for a patient who is a returning patient to Herzing University, and that I have completed this patient in one appointment. As I look at my SOAP notes, we're going to look at the heading. So right here, it says the first in series, second in series, etc. So my heading is going to be a first appointment in a series. So I'm going to go ahead and copy and paste this in. Age, gender, and presents for. So we got 23-year-old female, presents for a recall assessment. I am going to go ahead and I'm going to go back up. I am going to go ahead and copy and paste my medical history from my Eaglesoft comment box. Then I'm going to come down to the chief complaint. The chief complaint is an issue that a patient comes into the office and discusses it with you, whether they have a broken tooth or a toothache. In this situation, I'm just going to write none, but these are some of the questions that we're looking for if a patient does come in with an issue. We want to know what the problem is. We want to know what tooth is involved. We want to know the location. We want to know the duration. We want to know the symptoms. So we really want to ask some probing questions about what is this patient really experiencing. That way I can create, a mental image and put it in my notes for the dentist. So I'm just going to say none because the patient doesn't have any. For the last dental visit, this sometimes can get a little confusing. The last dental visit is where was the patient last seen. It does not mean that it was actually their dental office. So since this patient is a returning patient, the patient was last seen at Herzing University. And the reason was because the patient had a cleaning. So I am going to go ahead and I'm going to put the full date, the reason, and the location. The last dental exam, now that is where they have seen their dentist. Sometimes we don't know the exact date of the exam, but we want to get a good idea of it because remember, patients are required to have a comprehensive exam with their dentist every 3 years. So this patient was seen in May 2023 at Spring Dental. When it comes to x-rays, you are required to put the full date, which makes sense, right? If we have the x-rays on file, we should have the full date. So the patient is not sure when she had her a pano, but for the bite wings and the the full mouth set of x-rays, we do have the x-rays on file. We have, we got her x-rays from her office. And the bite wings were taken at HU. Then we're going to move on to dental history. The dental history is anything that the patient might have experienced as their dental history. Maybe some ortho, maybe they had their teeth removed, maybe they had a bad experience. So we want to write all of those in here. So this is kind of where you can start to get to know your patient on what has their history been in their dental world. So I'm going to go ahead and put this in here. Patient has had ortho 3 years ago and had their wisdom teeth removed and no negative experiences. For dental habits, this is what we're looking for as far as What are they, eating? What are they drinking? Um, oh, hang on one second. I'm going to put this back up here. I put this in habits. I apologize for that. We're going to put this up here. But yeah, what kind of habits is the patient doing? What is their diet like? So the habits I'm going to put in here. So patient drinks energy drinks. They like their coffee with cream. They love chocolate and chips. So this kind of gives me an idea of, what kind of an environment is the oral cavity in on a day-to-day basis. POH means personal oral hygiene habits. What does the patient do every day? How are they brushing? How are they flossing? So this patient brushes twice a day. They are flossing once a week. They are rinsing with mouthwash, Act fluoride mouthwash, which is fantastic, and the patient scrapes their tongue every night. So that kind of gives you an idea of what the S is supposed to look like. When we go to the O, this is our observation. Remember, this is our objectives. What are we seeing? Okay. We're going to go through every single one. So lymph nodes within normal limits, skin integrity within normal limits. Then we get to the temporal mandibular joint, the TMJ. Patient has bilateral popping, no discomfort. Thyroid is within normal limits. And then we're going to go into the lips. They're dry and kind of chapped, hence the winter seasons here. Buccal mucosa, let's say the patient has bilateral linea alba. Soft palate is within normal limits. Hard palate, let's say the patient has torus palatinus. Pharynx within normal limits. Tongue has a slight white coat. And the floor of the mouth is within normal limits. Alveolar ridge within normal limits. Now, when we get to the gingival description, it's important that we do a generalized gingival description through the color, the consistency, the contour, the texture. And that kind of gives us an idea of the overall oral, the gingival description. If you have an area that has kind of stands out, right? That's when we localize it. So for this gingival description, I'm going to say it's generalized light red, it's rolled, it's festooned, it's soft and spongy, but it's localized bulbous on the tissues between 22 and 23. So what I'm trying to do for the gingival description is create a visual image. When I read this, I have an idea of exactly what the patient's gingival description looks like. Occlusion is class 1 on both sides. Remember, we use Roman numerals for that. We have a 3 millimeter overjet and overbite. And as you can see, I'm getting rid of these parentheses to clean up the notes. For other, we have crowding, torsolingual buccal-verted, crossbite, open bite, edge to edge, or end to end. If there is nothing in the patient's occlusion that states that, I'm just going to get rid of it. I don't need it. For the hard tissue, we want specific teeth. However, please take note that if the patient has 30% or more in their mouth of what we're looking at, we can generalize it. So for, like, say, demineralization, I'm looking in the mouth, and there's 30% of the teeth that have demineralization. I'm just going to say generalized throughout. And that's okay. Same with dysplasia. If there is specific teeth involved, that's less than 30%, we're going to put the teeth numbers. So I'm going to say number 9, number 10, and number 11. Abrasion, again, if it's more than 30%, you can say generalized. So I am going to say generalized throughout. Oops. Abfraction, I am going to say this is within normal limits. Erosion within normal limits. And then attrition, I'm going to say slight on anterior teeth. When it comes to attrition, you must state slight, moderate, or severe. If it is slight, the attrition means that it's only within the enamel. It's moderate if there's dentin exposure, and it's severe if more than 1/3 of the tooth is missing. This gives us an idea how the attrition progresses from appointment to appointment. It's good that we note it, but we need to know we have to create some kind of measure, and that slight, moderate, or severe is our measure. The extrinsic staining, the patient doesn't have any. I'm going to say within normal limits. Defective restorations, I'm going to say none. Suspects, I'm going to say none. This patient is overall good. Other. This one is if you see any like deep pit and fissures that you think that the patient would benefit from sealants. I'm going to say right now, just for purposes, that the patient doesn't have any, and I'm just going to get rid of it. Then we're going to move on to the radiographic findings. Now, you guys are going to understand the staging and grading a little bit better as you get through Periodontology 1. So for perio, we have right here, we're looking for a recession. That's the main thing. And I'm just going to say the patient doesn't have anything. So I'm going to say no recession. Then we're going to go into the staging. CAL, remember, is clinical attachment level. I'm going to say within normal limits. Radiographic bone loss, I'm going to take a look at the x-rays. I'm going to say no bone loss. Patient has not lost any teeth to periodontology. My formatting is going to come off a little bit. Complexity, we're looking for probing depths, furcation involvement, and mobility. Patient doesn't have any. So I'm going to say within normal limits. The extent and distribution is within normal limits. And then we're going to go into the grading. Now, when we grade, we are looking for direct, indirect, and modifiers. Since the patient doesn't have any bone loss, we are going to get rid of all of the direct and indirect, and I'm going to say within normal limits. And the patient has no modifiers. The modifiers are diabetes and smoking, and the patient doesn't do either, so I'm going to write none. When you go into the plaque and the calculus, as you can see here, it is asking for the description, the amount, and the location. So I am going to go ahead and say that this patient has scattered and light throughout the entire dentition. So that kind of gives me an idea of where the patient's overall biofilm is. The same thing with the calc. Description, amount, and location. I'm going to say that the patient is moderate on the lower anteriors and scattered in the posterior subgingival. So this kind of gives me an idea of where the calculus is in the mouth. Again, I'm trying to paint a picture. For the hemo, it says description, amount, and location. I'm going to go ahead and say that during my probing, it was moderate bleeding, which would make sense because the gum tissue isn't really healthy right now. When it comes to perio stage, we do not grade or stage if the patient is healthy or if the patient has gingivitis. So my patient has gingivitis because the gingival tissue is, showing signs of inflammation, and the patient has no bone loss. So I'm going to go ahead and get rid of all of this. Oh, excuse me. And say my patient has gingivitis. At this point, we're going to come down here, and I am going to say, I'm going to use my camera, and I'm going to say that during my classification, I classified my patient as a moderate, carries risk due to the energy drinks and coffee. Now I'm going to take a look at my green sheet, and I'm going to look at my calc description up here. And from that, I have to determine what is the patient's deposit level. And by looking at everything, I'm going to classify my patient as deposit level 2. And the patient is on medication, so I am going to classify my patient as an ASA 2. Now, at this point, you're going to get your instructor over, you're going to do your initial assessment, and then you're going to put your treatment plan together, and then you're going to go ahead and start with your PI score. So I'm going to come back up to the PI score, and if you take a look at my plaque, it's scattered in light throughout. So I'm going to do my PI score. Now, it would not make sense if my patient was like an 89% PI score, because if my patient was 89%, I would consider that more heavy plaque. So I'm going to say my patient has like 23%, which would make sense to me because if my patient, that would be considered light and scattered in my opinion. The DHDs, I'm not going to go into it in this presentation. You guys are just learning about that, but this is where you would put your statements. So now we're going to get down to P. Okay, so our P is our plan, our procedure, and you can see right here it says treatment walked out or started. This is what you basically completed on your patient. So since I completed my patient in one appointment, I'm going to go ahead and just put in here what I did. I completed my assessment, I completed my OHI, I completed my adult prophy, and I completed my fluoride. And then underneath here we have patient swished with that mouthwash, and then it says here, what did you do, what did you said, or what was said, what was instructed, and what did you use? So today, what did I do? Okay, I scaled the entire dentition with my hand instruments. I polished with Patterson Fine Grit Mint Prophy Paste. I applied fluoride, and the patient had no adverse reactions. For my CC, my chief complaint, my patient didn't have anything, so nothing to address. Your DHD is right here. This is where you're going to address your DHDs. Again, I'm not going to go into it at this point because you guys are just learning about that, but this is where you would put your addressing of your DHDs. And then we're going to fill in these blanks. Told patient that they had no bone loss and that they were categorized as a caries class moderate because of energy drinks and coffee. Then the referral and OAR. Patient understands no formal exam or diagnosis was completed by the dentist today because our dentists do not do any type of an examination. And we discussed the patient to see their dentist on a regular, for a regular exam on the whole mouth with emphasis on. And so this would be the area where you would write if there's any suspects or any concerns that you have on the patient. But the patient didn't have any, so I'm going to get rid of that, and I'm just going to say for a regular exam of the whole mouth. When you go into your OHI needs to be pretty specific. Everything that you say to your patient, everything that you do to your patient needs to be documented in the oral hygiene instructions. So this is going to be the bulk of your SOAP notes in your P. Then, what did you dispense? All right, so I dispensed a toothbrush, I dispensed floss, toothpaste, I did a soft pick, and I gave my patient an OAR. Then I'm going to state the patient's goal. The patient's goal is stated within the oral hygiene instructions. You want to ask your patient, like, what kind of goal would you like to achieve by the next time that I see you? Patient told me that they want to start flossing 3 times a week, which is a great goal. Then here, RTC means return to clinic or a recall. A return to clinic is when a patient is still in a series, okay? Meaning maybe you did the initial assessment and you didn't get the teeth cleaned. Maybe the patient is coming back for something else that you need to see the patient for. But because I completed the patient, meaning I put fluoride on their teeth, I'm going to create a recall. And I'm going to see this patient every 6 months. Then I need to choose one. My treatment is complete because I put fluoride on their teeth are cleaned, they're good to go. Then the student signs, and DHS means dental hygiene student. And then your instructor will sign. At this point, then you would have your instructor go over all of your notes, make any modifications that are needed, and then you would copy and paste these notes into your patient's EagleSoft chart. I hope this helped.